Hello guys, how are you all? Hello guys, how are you all? Hi Manish, Karthik, surgery, don't worry. So we shall discuss everything possible things over here. I can see only 70 students are appearing for this FMGE exam. Yeah. Arey Ankush, there's nothing like that. It is all your hard work. Good evening, Hariharan, Mayur, good evening. Kusum, good evening, Kusum. I'm fine, Mayur, thank you so much. So what I expected is at least there would be 300 questions in FMG exam, which would eventually bring at least 300 students in the live. So if any one of your friends are even appearing for the exam, please do share for them also. Few students you don't want me to say only few points, right? Right. So Parth Patel, Nainatara, good evening. Good evening. So, guys, this would be just a short session, okay? Short session. And in this particular session, we shall be discussing these four important points. I think on the screen you can see these four important points, right? So, these four important points are the things which you are searching for, I hope, right? I will answer all of your questions. I will answer all of your questions, guys. So there are 134 students in the room. Let us wait for 2 more minutes, and then I'll tell you what I have decided to tell you today. Don't worry at all. I can understand. I can understand. Not only in the last 20 days, from the past 1 month itself, the anxiety period starts. Okay, so most of the students in this period, what they do is that in the starting they might have prepared all the subjects, but by the time they come to the end they leave most of the subjects. Now this is the major mistake that the students do, but don't worry, we have a backup for everything of that. Good evening, Lydia. Rohit Sharma, don't worry. Right, so let us, I think it is good to go, right? So what I will be doing is that, guys, what I'll be doing is that, first of all, let me tell you my version. Okay. Hi, Paras. Dr. Nab, good evening. Good evening. Rohit Sharma, yes, I know. Share this to your friends, guys. At least we need to get a target of around at least 200 so that we can proceed further, or else we shall continue the part over here for all of you guys. So far, how is your preparation going on, guys? So far, how is your preparation going on? Are you confident? अभी ये देखो, don't think that, don't think that I'm not remembering everything, right? So I'm forgetting easily everything. I can't able to revise. For example, if I sit like this and if I think about a topic in surgery or a topic in medicine, I can't recollect this. Don't think about that. Always and always believe in your hard work. You have done hard work, you will pass. That is for sure. So there is something called as gut feeling. All of you know that, right? So what is your gut feeling telling you? That is very, very important. I'm telling you. So what is your gut feeling telling? Are you confident? Are you all confident? Yeah. Chalo, let's start. Let's start. Okay. So if you look here, very good, Mayur. So first of all, how does this session go is that I will tell you my version here. Okay. So first of all, let me finish up all these four important questions. I'll come back to your comments later on. Let me finish up all these four important questions. Now, after this, I will answer your questions. Okay. Now, remember one thing. Remember one thing. No matter how much you have studied, no matter how many subjects you have revised, The last 20 days or 30 days, we have got 19 to 20 days roughly, right? So the last 19 days is very crucial. So the amount of information which you retain in this last 19 days is very important. Only that remains with you. Keep this thing in mind. Okay. Now, keeping that thing in mind, let us proceed. Now, the first important thing is which subjects you need to concentrate. Which subjects you need to concentrate is that, do you need to concentrate all the 19 subjects to pass the exam? Not at all needed. Okay. You just need to be perfect with 10 subjects. And I'm telling you, if you be perfect with 10 subjects, you are going to get 200 plus marks. Now, how is that possible? I'll tell you. Okay. Right. So, the first important question which we shall be discussing is which subjects you have to concentrate. All of you just look at this particular slide over here. Now, in this, I have divided the subjects based upon top priority, moderately important and least important subjects. Now, the subjects which I did not put here, the reason is that they're not that important, right? That is not the reason. The reason is that we don't have time in these 20 days. I want all of you to pass the exam. Okay, so that is our target. The most top priority subjects are, all of you know that there are 4 subjects which are very important and you have to study at any cost. So that is your surgery, that comes under the surgery, the medicine, the OBGY and the PSM. Okay. Now, all these subjects together roughly will cover around how many marks? 30, 30, 30, 30. How many marks? You see all of these subjects over here. The second is the moderately important subjects coming to anatomy, physiology and biochemistry. So overall if you look here, overall the subjects cover around 216 marks. 216 marks. Okay. Now, what you guys might think that, what if they don't give the blueprint as it is? You told me surgery 30 marks, medicine 30 marks, right? What if they give only 20 marks from medicine? What if they give excess marks from physiology and all? Whatever it might be, max to max, how many questions difference can be there, guys? How many marks difference can be there? Let us say max to max, there are 20 marks difference. Even if they are not following the blueprint, max to max 20 marks difference can be there, but still you can get 180 plus. Yes or no? You can still get 180 plus. Okay. Now, this is one of the very important thing which I want you to put in your mind. Now, tell me, how many of you are perfect with all of these subjects? Even if you are not perfect with all of these subjects, still there is a chance for you to pass. Always remember, guys, in these subjects which I have kept over here, the first 4 subjects you have to finish at any cost. उसके लिए तो you can't do anything. Now, how do you finish? How do you study? What are the topics you have to study? I have already prepared a list. Okay. Now, when it comes to this one, you see this subject, forensic medicine, ENT, ophthalmology. These are 3 such subjects which are easy to finish. And manlo, the questions which are asked from ophthalmology, the questions which are asked from ENT, the questions which are asked from forensic medicine are direct questions. If you study these subjects perfectly, I'm telling you, you can score out of marks. Okay, 5-6 marks, even if there is a difference, but you can score the maximum marks. These 3 are the scoring subjects from the list which I have given. Now, why am I telling you, on what basis I'm telling you, is that I'm confident enough that many students told me that they have scored maximum marks in this optal, ENT as well as forensic medicine. So these are the scoring subjects. Topics are easy. The questions are directly asked. No twisted questions. Keep this thing in mind. Next important thing you need to know is that, for example, what do you mean by you have to be perfect with all these subjects? Should you get 30 out of 30 in surgery? Not at all needed. Should you get 30 out of 30 in medicine? Should you get 17 out of 17 in anatomy? Not at all needed. Okay. So, for example, out of 30, even if you get 25 in all of these, out of 17, even if you get 10 out of all of these, 10 in each subject, pediatrics, opthal, ENT, 15 questions are gonna come roughly, plus and minus 1 or 2. Still, if you remove 5 marks and get 10 out of, in each of them, right? You see, I know anatomy is really difficult. Physiology, biochemistry are a little bit easier in comparison with the anatomy. Leave 7 marks, I'm telling you. Still, if you count all of them, still you are going to get 165, which means you are 15 points on the safer side. So, this is your decision that which subjects you want to concentrate, which subjects you wanted to leave. Now, what I will tell you is that you should never ever leave these subjects. Sir, I left some subjects from here. Now, मुझे बहुत time लगेगा अभी. Now I get a lot of time right now. It would consume a lot of time to study all these subjects. So can you please shorter these subjects? If you want me to still more shorter these subjects, study only 4 subjects. These 4 subjects are your surgery, medicine. What are they? Surgery, medicine, OBGY as well as PSM. Okay. So these are the 4 subjects which you need to be perfect. Now, one thing I'm telling you, I will also share you my personal experience. Just 2 to 3 days before, I've talked with the students which are freshly, they passed the exam. Okay. So most of the students I know, but I've called few specific students. I will tell you what did they tell me. But remember one thing, if you are perfect in these 20 days, kuch bhi kar lo bhai, right? You study day and night, you watch the rapid revisions, you study the notes of different apps or whatever it is. I want you to be at least 70% perfect in these 4 subjects. Why am I telling you is, if you are perfect with medicine, most of the topics will be covered. If you are perfect with surgery also, most of the topics will be covered. Keep this thing in mind. And if you are perfect with PSM, in the PSM you have got the infectious part. Most of the microbiology will be covered. The vaccines in the microbiology will be covered. I have called a few students, one from Chandigarh and Jharkhand and all. So, few students whom I know personally. One of the student, I don't know if they have joined the live session or not now, but one of the student got 172 marks. One got 181, and the third one somewhere 190, somewhere he is there in between. So when I call them, I ask them, how did you prepare for your exam? Tell me honestly. What they told is that, sir, we started our preparation with all the subjects, right? In the starting few months, in the starting 4 to 5 months, we almost finished all the subjects, leaving 3 or 4 subjects, maximum subjects we thought to cover. But by the time we came to the exam, right? By the time it is already 1 month near to the exam, they were telling that they couldn't revise all these subjects, so they had to leave some subjects, they forgot some subjects. But the seniors, the faculty and all, they kept on telling to be perfect with these 4 subjects so that these 4 subjects would cover up the remaining subjects, and that is what they did. What they told me is that, sir, हमने ये 4 subjects को इतना बुरा रट लिया कि we are so perfect with these 4 subjects. And they were telling me that most of the questions, let us say from physiology, from dermatology, right? Let us say from other subjects like biochemistry and all, right? So most of the questions, they felt that they are asked from the medicine part itself. Why? Because when you are perfect with these 4 subjects, the reality is they are going to cover the remaining subjects also. So even I'm not telling you you will get 200 plus, but I am confidently telling you you will at least get 160 plus if you are perfect with these 4 subjects. Okay. Now the real question is here. What is the real question? How many days I have to study these subjects? How should I divide? You have got, let us say, 20 days. There are no 20 days, but you have got 20 days, for example. Within these 20 days, give 2 days for your surgery, 2 days for your medicine, 2 days for your OBG, 2 days for your PSM. Okay. Now you guys honestly tell me, ENT chota subject hai. Don't you think 1 day is enough? Right? Ophthalmology, small subject, 1 day is enough. Okay, pediatrics is a clinical subject, little bit bigger, almost equivalent to medicine. ठीक है, 2 दिन रख लो. Physiology, biochemistry, 1 day is enough, right? Anatomy, ठीक है, anatomy is difficult subject. You are telling me that anatomy, let us put it 2 days. खूब मिला के कितना हुआ? 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 16 days. The remaining 3 days, what will you do? The remaining 3 days, you can concentrate on the MCQs. The remaining 3 days, you can be perfect on those topics which you feel you are weak. So 16 days is the schedule here, guys. This is not even a tight schedule. I'll come to the image-based questions also, Shubham. I'll come to the image-based questions also. So this is the plan which I'm telling you. Okay. Always and always remember, this is the priority. If you have very good time, if you have at least studied these subjects, then don't leave any subject if you have studied this. If you haven't studied, sir, मैं ophthalmology अभी तक नहीं पढ़ा. It is possible to study now. Sir, मैंने surgery अभी तक नहीं पढ़ा. What do? You don't study the total surgery, rather you study only the rapid revision session. I'm telling you. Any rapid revision, by anything. There are rapid revision sessions in our channel also. You watch, your wish. If any other channel there, they're teaching better, less time, go there and watch. Whatever it is. Okay. But sir, I did not study anatomy till now. Right? Again, I'm telling you. From these subjects, whichever subject you haven't touched, watch only the rapid revision videos of those subjects, but don't leave these subjects. If you are perfect with these subjects, after the exam, you guys come and comment down. You will comment down definitely that most of the questions got repeated from these subjects. I will also, in a minute, I will tell you what are the sure shot questions that will be 100% asked in every exam. Okay, so I'll also tell you those topics. So I hope guys, all of you understood that this priority is very important, and most of you might have been in different coaching institutes, even you know that most of them follow this priority. Now, next important thing is that what subjects should I study? Now, I will tell you what list of important topics which you need to study for each and every subject. Okay. So here we have got 10 subjects over here. I will tell you the list of important topics of only these 10 subjects. But in the Telegram, I will put down the list of important topics of each and every subject. Okay. So if you look at the subjects over here, let us start with anatomy. Okay. Now in anatomy, so far till today, till the last exam, if you look at the paper, most of the questions were asked from abdomen. I want all of you to take a screenshot. Most of the exams questions are asked from abdomen and pelvis. Second is head and neck, then thorax and upper limb. Most of the questions got repeated from this. Okay. Now, when it comes to abdomen and pelvis, the topics which I want you to be perfect is these 9 topics. Whatever it is, however they ask you, right? You have to be perfect with these 9 topics in abdomen and pelvis. Just go through the topics. I'm not going to individually point out each topic. Just go through the topics and you know how important these topics are. When it comes to the head and neck, these are the topics which are very, very, very important in head and neck. And coming to the thorax as well as upper limb. Okay. Now, after this anatomy, this is what you have to study for 2 days. Tell me, do you really need 2 days to study anatomy or for all these topics? Don't you think 1 day is enough for this? Right? Next important thing. Coming to the physiology, these are the 14 important topics which are filtered out and I have kept it here. These were the topics which are repeated every year. Keep this thing in mind. Okay. So if you are perfect with these topics in physiology, most of the questions will be covered. I'm telling you, you will be on the safe side. Safe side matlab at least out of 17, 10 questions to pakka aayega. That is my promise. Now, most of you are asking here, sir, what about image-based questions? Regarding image-based questions also I will tell you, but let me tell you now itself. Once if you have planned this, okay, 2 days, 1 day and all. Once if you have planned this, what I have seen in most of the students is that, what I have personally requested them also is that daily 1 hour you completely dedicate yourself for image based questions, whatever subject it might be. You very well know by now from which subjects image based questions are asked. Radiology ho gaya, dermatology ho gaya, right? Anatomy also image based questions are asked. Microbiology, they will ask you the staining methods, right? So even from surgery they will ask you the instruments. So in this way, you know the subjects now. Daily 1 hour completely for image based questions, no matter what. And I prefer you to use daily 1 hour to spend the time in the night time for the image based questions, because in the night time you grasp the images very nicely. Okay, so daily 1 hour for image based questions, daily 1 hour for image based questions. So this is what I want you to keep in mind. Okay, now next important thing, coming to the physiology, these are the 14 topics which you need to know regarding the physiology. Now coming to the biochemistry, always and always remember, most of you people think that biochemistry is really really difficult. Okay, let me tell you one thing, Abhishek, regarding medicine also I will put down the important questions. Guys, let me finish this up, I'll come back to you in a minute. Okay, coming to biochemistry, most of you think biochemistry is difficult, but I will tell you one thing, trust me that most of the questions of biochemistry will be asked from vitamins. Okay, vitamins and its deficiencies, or enzyme deficiencies. Enzyme deficiencies jante ho na? Like for example, there are enzyme deficiencies like लिपिड स्टोरेज डिसीजेस, ग्लाइकोजन स्टोरेज डिसीजेस, है ना? ये स्टोरेज डिजीज जो है, अमीनो एसिड मेटाबॉलिक डिसीजेस जानते हो ना? यू कम अक्रॉस फिनाइल कीटोन्यूरिया, all of you know this. Yes, phenylalanine metabolism disorders. So all these are named disorders, right? All these are named disorders. Alkaptonuria, right? Homocystinuria. So all these things, only study these things, I'm telling you. Only focus on these things. Okay, if you have time, you go back to the cycles, or if you have more time, go back to the ATP, kitne generate hoga, NADP, that and this and all. But definitely 100% I'm telling you, one question from vitamin deficiencies they will ask. Either they can give you a picture and ask what is the vitamin that is deficient. One question or two questions definitely they will ask you from enzyme deficiencies. Ye to pakka hai. Mark my words, this is for sure. Okay, this is for sure. Right. So this is the order of importance so far which was repeated. Vitamins, then lipid metabolism, then amino acid disorders, and last I have kept carbohydrate metabolic disorders. Okay, or carbohydrate metabolism. So these topics over here are one of the very important topics which you need to practice these topics over here. Okay? Next important thing is regarding the surgery. Now surgery is a major part. Now these topics, whatever I have kept it here, these are the filtered topics. Okay, so in these filtered topics, all of you know one question 100% every year that is asked is from the breast. From the breast, every year one question will definitely be asked. Keep this thing in mind. Okay, so always and always don't forget to study this. You have to study this topic. So these are the list of the topics which you study from the surgery. Okay, hope you have taken a screenshot. Next, if you look at medicine, these are the 17 important topics which you need to study from medicine. Okay, these are the 17 important topics which you need to study for medicine for 2 days. 2 days time diya tha na uske liye. For 2 days, these are the topics which you need to study. Okay, now out of all this, again, what is a sure shot question? I will tell you later on. But here, what is a sure shot question is that, definitely there will be one question regarding viral hepatitis. They are going to ask you what are the different markers of hepatitis. है ना? Hepatitis B का mainly पूछेंगे. They'll mainly ask you about hepatitis B markers. Okay, keep this thing in mind. I will answer all of your questions. Just give me a minute. Let me finish this up. Coming to obstetrics and gynecology, these are the questions which are asked from obstetrics, and these are the questions which are asked from gynecology. Okay. So very important thing they are going to ask you is about antepartum hemorrhage. This is one of the very important topic, right? And from here, the most important topic which they're going to ask you is regarding the amenorrhea. Amenorrhea is also a very important topic. Okay, so this is also, don't leave this topic. For the pathology I haven't kept here. Pathology I will include the remaining subjects in the telegram. In the PDF I'll put those remaining subjects. So only those 10 subjects which you have to study, only regarding those 10 subjects I have kept this thing. Okay, so in the telegram you will find the remaining subjects, important topics also. Okay, right. Coming to the community medicine, all of you look here, guys. These are the important topics in the community medicine. Okay, all of you have studied, I think, in the starting of community medicine cohort, right? All of you have studied this retrograde study, cohort study. All of you have studied this. So from that, definitely one question is going to come. Okay, from the studies, from the cohort studies, right? Definitely one question is going to come. They will give you an example and they will ask you, tell me what type of study is this. Okay, so this is a study based upon a future, or this is a study based upon the past, cohort or all. So all these things they are going to definitely ask you. Okay, so never ever forget that retrospective studies, definitely you will get a question from that. Now coming to the pediatrics, these are the questions which will be mainly asked. These are the questions which will be mainly asked from pediatrics. Keep this thing in mind. Okay, so these are very important questions. Apart from this, you know what questions they will ask in pediatrics? 100% question one they will ask you is rashes, childhood rashes. What are the rashes you see in hand, foot, mouth disease? What are the rashes you see in case of measles? What are the rashes you see in case of rubella? Right? What are the rashes you see in case of roseola infantum? So these rashes, 100% one question at any cost they will ask you. Keep this thing in mind. Second important thing, all of you, I think it is very difficult for you to study the milestones, right? But remember one thing, if I tell you that from milestones one question is going to come, then won't you study milestones? Kuch bhi kar lo, rat lo, whatever it is, guys. From milestones, one question, 100% it is going to come in the exam. That is for sure. Okay, right. Coming to ophthalmology, in ophthalmology, these are the 5 important topics which you need to focus, but don't leave glaucoma as well as cataracts. Glaucoma as well as cataracts, glaucoma as well as cataracts. From these glaucoma as well as cataracts, definitely you will get a question. Okay, so I can understand, guys, most of you might have noodles and pasta right now, right, in your brains going on right now. So don't worry, we shall just structuralize everything clearly once again. Don't worry about that. So trust me blindly, you have to trust someone. So these days you have trusted your faculties, you have taken the notes, you are studying. Now what I am telling you is that from those notes only, I am telling you to study these 4 topics, these 5 topics, because these are the topics which are repeated every year. Okay, so when it comes to ENT, these are the most important topics which are asked in ENT. Okay, now all of you remember, guys, in ENT bacterial infections are all the time asked. All the time bacterial infections are asked. All the time bacterial infections are asked, and all the time diseases of ear are asked. Diseases of ear are very important. Even if you don't have time, don't study the throat, but study the diseases of ear at any cost. Okay, definitely you're gonna get the question. And you know another question from where you will get in ENT, all the audiometric studies. Audiometric studies. From all these audiometric studies, definitely you going to get one question. 100% one question will come. because every year the question has repeated. This year also definitely you're gonna get a question. Clear, all of you? Right. Now, next important thing. What is the next last important thing I want to tell you is that I just wanted to write down. There are some sure short questions which are asked every year. Okay. So let us just write down these sure short questions at any cost. At any cost, you should not leave these at all. Okay. First important thing is, you remember in psychiatry as well as in forensic medicine, if you look at the end, there is a box. This box is containing different types of paraphilias, masochism, sadism, all these things are there. You remember that? So paraphilias, every year 100% one question is definitely going to come from paraphilias. Definitely it will come. Second important thing is that in psychiatry, definitely one question, that is diagnostic criteria for schizophrenia. You remember the diagnostic criteria for schizophrenia? Definitely diagnostic criteria for schizophrenia is going to come. Diagnostic criteria of schizophrenia. Now, after this, discussing all of this, then I will answer your questions, guys. How to manage the time and all, everything I'll answer. Don't worry about that. So I did not just come here to teach you the important subjects and leave away. Full pack. I came here. I'll teach you everything. I'll deliver all the pack and then I'll leave. Okay. Third important question that is asked is nerve injuries. Anatomy say nerve injuries. Definitely they will ask. From anatomy, nerve injuries definitely they will ask. Nerve injuries in the sense, radial nerve injury हुआ तो क्या होगा? Ulnar nerve injury, median nerve injury, right? If there is injury to the common peroneal nerve, right? If there is injury to, let us say, the posterior tibial nerve. So nerve injuries are very, very, very important. Definitely you will get a question from nerve injuries. Either you get an image based question, like a claw hand, like a ape thumb deformity, like a pointing finger deformity. Either you are going to get an image based question or you are just going to get a theory based question. Okay, but nerve injuries pakka question. Fourth important thing, from your FMT, the forensic medicine itself, IPC sections. How many of you are perfect with IPC sections? Sir, मुझे याद नहीं है, IPC sections बहुत difficult है. I will tell you one trick. From today onwards till your exam, every day prepare 5 IPC sections. Today, right now after this session, prepare 5 IPC sections. Rat lo, 5 IPC sections जो है rat lo. Okay, stick it on the wall. Next day in the morning, revise that and again go to the next 5 IPC sections. Whatever it is, don't forget these IPC sections. You are definitely going to get a question from there. Fifth important thing is, from biochemistry, as I already told you, vitamin deficiencies. Vitamin deficiencies in the sense, once they have asked, not once, every year they have been asking, there can be image based questions from this or there can be direct questions. Image based questions matlab, they will give you hyperpigmentation of neck, like necklace neck, you remember? So they will ask you what vitamin is deficient over in this patient, right? They will give you, let us say, hypersegmented neutrophils, right? They will ask you which vitamin is deficient in this patient. They will give you chiliosis and all, right? Patient is also having diarrhea, confusion, diarrhea, dermatitis, dementia. Which vitamin is deficient? Or image based questions, but 110% one question is definitely going to come. Sixth important thing is enzyme deficiencies. Enzyme deficiencies, I have already spoke about this. Gaucher's disease, von Geirek's disease, right? You can also biochemistry में और क्या क्या है? Gaucher से, von Geirek से. I am not a faculty of biochemistry, इसीलिए याद नहीं आ रहे. बताओ. What are the Pompey's disease, McAlder's disease, right? You even have different kind of sphingolipid disorders. Sphingolipid disorders है ना? And lipid disorders are there, right? So all these named disorders जो भी है, be perfect with that. Open your textbook and be perfect with that. Sir, we cannot find it. पता क्या करो? USMLE first aid textbook है ना? Now don't worry about that, don't get afraid. USMLE first aid textbook mein, when you turn the pages to the biochemistry, there is a very big table of enzyme deficiencies. वो रट लो, 1 mark is in your pocket. Whatever it is, be perfect with that, 1 mark is in your pocket. Okay. Coming to the next important thing, every year one question is asked regarding EDH, SDH, right? Extradural hematoma and subdural hematoma. Either they can ask you from neurology part, I mean the medicine part से पूछ सकते हैं. अगर medicine part से पूछा, then they will give you a CT and they will ask you C shape है, biconvex hai, so what is this, right? If they give you from anatomy, they will directly ask you. Clear all of you? Which is the most common artery that is ruptured here, right? Most common cause. So these things, EDH, SDH, kuch bhi kar lo, be perfect. Okay. If you have time, then study subarachnoid hemorrhage also. Okay. 8th question, from biochemistry only again, you know, you have got 2 tables, list of drugs. Some are called enzyme inducers, some are called enzyme inhibitors. है ना, cytochrome P450 का question है. Enzyme inducers, enzyme inhibitors. Every year one question was asked from that. Enzyme inducers and inhibitors. Every year they asked one question. Enzyme inducers and inhibitors. And recently, just before this live session, I called to one of the famous faculty, I can't take his name, of forensic medicine, and I asked him, sir, so far in your experience of these papers and all, every year you are looking at the paper, every year you are doing the discussion, tell me one such topic that will definitely be asked. So he has given me few topics. I told him that these are the topics which I know. Now you tell me what are the topics which you know. He told me one definite topic which is going to come is poisoning. Within this, there are different types of poisoning. You remember? Poisoning with the seeds, poisoning with the leaves and all. Different types of poisonings and its antidotes. This is what he told. Okay? Poisonings and antidotes, definitely you are going to get a question. Okay? Now, apart from this poisonings and antidotes, there is one more question that is going to come, guys. What is that question is? I've just written it here. Yeah. Next important question is, in anesthesia, you see color coding, right? All of you know the color coding. So, anesthesia color coding. From anesthesia, from the topic color coding, right? You are going to get, don't study about the machines and all, right? Don't study about the machines. In anesthesia, you are going to get image based questions only. You know what image based question you will get in anesthesia? Mostly they will ask you to identify the type of mask. Hudson mask kaun sa hai, right? They will ask you, let us say, non-rebreathing mask, what is this? Bag mask, what is this, right? Valve mask, what is a ventilator? All these things. If they will intubate a patient and ask, what is this? Invasive, non-invasive, hai na? Mostly they will ask image-based questions. But regarding this color coding, I want you to remember, even color coding also, mostly they might ask you image-based questions or direct questions also they will ask you. Okay? Right. Next important thing which they will ask you is, in PSM, they will ask you about biomedical waste. Okay. 12th important topic is regarding the triage. All of you know, very important. And also levels of disease prevention. So these are the topics which I collected so far. Okay, these are the topics which I collected so far. Most of you are telling, sir, pin index se bhi question aayega. I will tell you that from pin index question will come, but there were few years where from pin index question did not repeat. That is the reason why मैंने यहाँ पे नहीं लिखा. I have written only those questions so far which are repeated. I'm not going to make a big list also, right? I'm not going to write 30-40 topics also. That would also doesn't look fair, है ना? So I am going to tell you these 12 topics which will definitely come, right? And after the exam, I want all of you to comment down in the comment box that what are the questions that have come over from these topics. Okay, so these are very important topics which you have to study every day. Second thing, image based questions every day, 1 hour image based questions. Every day, 5 IPC sections. Every day, 5 IPC sections. So these are some of the things which you have to remember, guys. Okay? Apart from this, these are the important topics which I have told you. Sir, बाकी subjects का भी importance topics दे दो ना. बाकी subjects का importance topics. I cannot discuss it here. I don't want to waste the time. I will give in the form of a PDF format and I will post it in the Telegram. So if you want to study only those subjects, only those topics, that is well and good. I'm telling you, trust me, that is well and good. Okay? Now, all of you look here. Why am I this confidently telling you is this, guys, मुझे कुछ लेना देना नहीं है, you know this thing, right? If the questions come, no money is going to come into my account. At the end, what is going to, you are going to get benefited. And I feel a little bit happy by looking at your comments, sir, ye question aaya, ye question aaya. That is the only thing I need, right? Now, coming to answering your questions, come on, guys, you have any questions? Ophthalmology, yeah, right. So let us, regarding the topics, guys, let us stop discussing regarding the topics. Most of you are asking staging of cancer or pharma ka important questions and all of these and all, right? So stop asking about the questions, because important questions of pharma and everything, again I'm telling you, I will put it in the form of a PDF format and I will send it in the Telegram by this night. Okay, so don't worry about that. Don't worry about that at any cost. Now, how do you revise pharma? So someone is asking, how do you revise pharma? How do you revise pharma is that whatever subject you study, okay, always and always remember one thing, that first study the mechanism of action and then start studying the drugs. Now, how do you remember the drugs? You use your mnemonic, you have a good practice on the drugs, whatever it is, you have to remember the drugs. Okay. So, sir, which topics I have to more concentrate on? Those topics I'll give you in the PDF. Okay, so keep that thing in mind. So this is the only way. Now, how to memorize in the sense, very easy, guys. Let us say after this live session, I started studying medicine. Okay, so in the medicine, I started studying, let us say, acute pancreatitis topic. ठीक है, acute pancreatitis पढ़ लिया, okay, symptoms ये है, okay, causes, these are the two causes. Coming to signs, two signs are very difficult. One is called as Great Turner sign, right? And there will be also another sign which I am not remembering right now. Okay? So these signs you are not able to remember. Write it down in a paper, leave it. Go study the next topic. Don't waste your time. Study the next topic. You started studying, let us say, cholecystitis and all, the Charcot triad and everything you have studied. You are not remembering the Charcot triad. Write it roughly. By the time, in the night time, 1 hour after finishing your image based questions, I told you every day 1 hour in the night you have to finish your image based questions. Before sleeping, you have to revise these things, and once after getting up also, you have to revise these things and then start the next subject. This is what you do. Still I am not able to remember, sir. Stick it on the wall. Study it daily along with the image based questions or along with the IPC sections, whatever it is. Study it daily. So this is the best way to remember the things. This is the best way to remember the things. Okay. Pushpendra, tukka kaise lagega? If I know that thing, okay, if I know that thing, definitely I would make a very wonderful session that is called as I would even write a book, Tukkology, where I would make a very wonderful session, page to page, of how we get a tukka here. Okay. Coming to Dharma and Ortho, Dharma Ortho is very good for images. Yaad rakho. Images definitely you will get from Dharma Ortho Radio. Most of the images you will get. Okay. So be perfect with the images in the dermatology. Okay, keep this thing in mind. From where you have to learn the image based questions. By image based questions ke liye na, honestly I'm telling you, if you have a PDF, study from the PDF. Okay, if you have not joined any coaching center, or if you don't have any app with you, go to the Telegram FMGE image based questions. You will have a n number of PDFs. Okay, open some random PDF. Open the PDF of Arise Medical Center, coaching center. Open the PDF of Prepladders, और जो भी faculty का PDF चाहते हो open कर लो, study that. Okay, that is the only thing we have. Medical Love is telling he got 165 and 163 in the national mock test. Definitely I'm telling you, Medical Love, you are going to pass the exam. Ye likh lo, right? So in the national exam, if you are getting these scores, and most of you might be thinking, sir, मुझे याद नहीं है exam में paper कैसे आएगा? Keep one thing in mind, that whatever you have studied, जितना भी difficult हो, right? Whatever questions you have studied, Prepladder का questions or Marrow का questions, they might be difficult, right? But when you go to the exam, the questions are much easier. Questions you feel difficult because you start overthinking on the questions. Don't overthink on the questions. Examiner has set the question very simply, very straightforwardly. You also have to think very simply, very straightforwardly. If you dive deep into the question, answer galat ho jayega. Now, whenever you are doing the questions, part 1 is preclinical, part 2 is clinical. All of you know, paraclinicals are mixed. Now, what I'm telling you is that don't stick on one question only, because there are some questions, by looking at the picture you can put the answer. There are some questions where definitely you need to think. Even a topper has to think. Okay, so first question, समझ में नहीं आया, चल निकल. Next question. Okay, I did not understand, leave. Third question, option 2 or option 3, I think, but I don't know which is a perfect answer. Okay, fine, leave. Fourth question. Now, most of the students, by the time they leave 4 questions, they think, oh my God, what is happening? I already left 4 questions. Will I fail in the exam? So with this type of psychological tension, the remaining questions be baad mein jayega. So I'm telling you, even keep a target of 15 questions. Agar 15 questions be continuously, if you are leaving, nothing is going to happen. You have clinical subjects in the next part. Ye yaad rakho. They will save you. Okay? So keep this thing in mind. Continuously 15 questions you have skipped, nothing to worry at all. Okay? So first do those questions which you know. Don't spend more than 2-3 minutes. If you are taking time 2 to 3 minutes on one question, then leave that question immediately. Don't even look at that question. Okay? So by just looking at the question, you are able to answer it. Do it fastly. ठीक है, पूरा पेपर 10 मिनट में खत्म हो रहे, होने दो. By leaving all the questions, again you can come back, again you can detailedly look at each and every question. Keep this thing in mind. Okay, never ever get stuck at a single question. ये बात याद रखो guys, please. Next, most of you are telling that Gokul, it will be enough, Gokul, it will be enough, क्योंकि मैंने ये जो टाइम टेबल लगाया था, है ना, this thing 2 days, right? Still 4 days are left here. Most of you are asking here about the grant test. Okay, I'm telling you one thing. Recently, I'm not going to tell you the name of the institute. Recently, I've been to Delhi. Okay, so before this exam, before the previous exam, 15-20 days before, I was there in the Delhi, you know, in the Gautam Nagar. So most of the students who knew me, they came to me and they were talking to me. I just asked them, how many grant tests did you give? They told me, भैया सब बोल रहे grant test दे दो, grant test बहुत important है. I agree that grant tests are very important, but जरूरी नहीं है कि if you did not give at least one grant test, you are going to fail in the exam. No, remove that myth in your mind. And those 4 to 5 students, one of them failed, but remaining 4 students, they passed the exam. उसमें से एक को 211 marks आया था. Okay, grant test देना जरूरी नहीं है. If you have time, if you are perfect with all these subjects which I have told right now, after this session right now, immediately start giving grant tests. Okay, even if you did not give grant test, but still if you are confident enough that you can solve these questions, you will pass. कितना लेकर आना है यार? 150 तो लेकर आना है ना? 150 marks. Sir, I got 130 in the national mock test. Marrow, it is a good score. Yes, very good, Meghna. Marrow is a good score. In Marrow, if you got above 130, 140 and 150, it means in the real exam, the question's complexity will be less so that you can get a very good score. Any more questions, guys? Any more questions you have got? MCQs नहीं सॉल्व किया बहुत ज्यादा, बट रिवीजन किया है. I will pass. देखो, MCQs, why we basically tell you to do more and more MCQs is that the moment you enter into the exam, ठीक है, मान लो कि I did a lot of MCQs, okay, the moment I get into the exam I won't have the tension. The moment I look at an MCQ, अच्छा इस टाइप का MCQs तो बहुत किया मैंने. अच्छा, okay, second question, image based. Oh, I did a lot of image based questions. अच्छा, they are asking indirect question. I have did a lot of indirect questions. So that will be my mentality in the exam. But if you haven't done any MCQs, मैं ये नहीं बोल रहा हूँ कि you can't pass, right? ऐसे नहीं होगा कि तुमने आज तक till today you did not even do one MCQ also. You might have done some MCQs, right? Right? Some MCQs. To remove that fear, you basically do the MCQs. Okay? Or to get new points, to fetch out the new points from the topic, you do the MCQs. But don't worry. If you perfectly use this 20 days, use like hell. I'm telling you. Use like hell. Throw your mobile aside. Don't even use it. 20 days is your deciding factor. ये याद रखो. 20 days. Just go grab the thing. Go grab those 150 marks. 20 days, only these subjects, trust me. Medico G is telling he has done previous year questions. If you have done previous year questions of the past 6 years, you pass the exam. ये याद रखो. Past 6 years previous year questions, if you have done, you pass the exam. Right now I'm telling you. ये नहीं है कि रटना है वो questions को, है ना, past 6 years का. Not ratna. I'm not talking about by hearting the questions. I'm talking about conceptually studying each and every question, understanding why this is an option, why the remaining are not an options. If you are doing that for the past 6 year question papers, you will pass the exam. Shubham Malhotra, more than enough. More than enough. सर अभी एक सब्जेक्ट और फोकस नहीं हो पाता, फर्स्ट स्टार्ट करते. गाइस आस्क इन इंग्लिश, ठीक है? आई एम नॉट ए प्रो हिंदी स्पीकर ऑल्सो. Arvind Singh, you are getting 200 plus in the mock. Is it a good score? Definitely your score will be above 210 in the exam. Keep that thing in mind. है ना? I'm not an astrologer, है ना? I'm not telling you as an astrologer. By the experience which I got from the students only, I'm telling you. With a lot of research only, I'm telling you. Blindly, I won't tell anything to you at any cost, promise. Okay? So if you're getting 200 plus in the grand tests, in the main exams, in the main exam, you will get definitely 210 plus. Okay? Keep that thing in mind. Sir is joining QRS sessions in the coaching. A good idea, definitely a good idea. But if you are more confident than the QRS questions that you can prepare it by yourself, then that will be well and good. Okay? So there are students who even didn't attend any coaching center, but still they managed to pass the exam. Pushpendra Patel is telling he got in Marrow Grant as 165, but he is feeling low confident. See, it is because of the low confidence you might fail in the exam, not because of the grant test marks. Your grant test marks are awesome. I'm telling you, with your grant test marks, I can roughly estimate around 180, 190 if you continue the same pace till the exam. But if you are low even the day before the exam, most of the questions you might get wrong. Okay, so deal with that thing. Ashish Sharma is asking how many questions you have to solve per day. Per day depends upon you. I am telling you 2 days for surgery here. Okay. So if you manage to study, surgery, if you manage to study finish surgery in 1.5 days, the remaining part do MCQs. Sir, कितने घंटे पढ़ना है daily? Till you finish, you have to study. I did not eat food. Leave it. कुछ नहीं होगा. Okay. If you take little amount of food, that is more than enough. Okay, you started the subject, you have to finish only then get up. क्योंकि सिर्फ 20 दिन बचा है, 20 दिन बचा है. The more damage you give to your body, the better result you get. Very frankly, I'm speaking. Okay, keep this thing in mind. Dilip, very good. It is a game of mindset, passing or failing. Yes, really, that's very true. Sir, if I don't know a subject like pharma, what to do? If you don't know a subject like pharma, leave it. Okay? Abhi, now you don't study any new subjects. If you have to study any new subject, study from this list only. From this list only. Okay? Sir, abhi pura padna hai? No, you just need to study. If the subject is ENT, short subject, pura pad lo. If the subject is surgery, very lengthy subject, study only the rapid revision. This is what I'm telling you. But don't leave these subjects. Again, I'm stressing you, don't leave these subjects. IBQ kahan se kare? I have already told Manav Sharma, image based questions. If you have an app, that is well and good. Go to the Telegram if you don't have an app. वहाँ पे FMGE IBQs करके टाइप करो. बहुत सारे channels you will get. In those channels, they will be sharing a lot of image based questions, PDFs. Download those PDFs, study that. Okay. Rohit Sharma, biochemistry you need not to study completely. I've been telling you this all the time. Biochemistry, only few topics, right? Vitamins, pakka ek question. Enzyme deficiencies, named enzyme deficiencies and a Gaucher's disease, von Geierke disease and all. Definitely one question will come. Okay. These two things, keep this thing in mind. Definitely 2 questions will cover up your biochemistry, and remaining from these part, you better check it out. Sir, whenever sitting in the exam, almost every question seems like every question is from pharmacology and medicine. So that is what Gokul Raj I'm telling you. That is what I'm telling you. If you are perfect with these 4 subjects, right? Even if the question is coming from pharma, from physio, from biochem, क्या फर्क पड़ेगा? If you are perfect with this, then those questions you will be able to solve. है कि नहीं? So ये pharma का question है क्या? ये medicine का question है क्या? Don't think like that. Okay? There are a bunch of questions, you have to answer them. And you know the concept. Kaise? You studied these 4 subjects perfectly. Bas. Sir, if I start now, can I pass, please? If you start now, you can pass. I cannot give you 100% guarantee, but I'm telling you the fact. Fact ये है कि मैं 100% guarantee नहीं दे सकता. Second important thing is that I can also tell you that you can pass the exam if you sit vigorously. Vigorously in the sense daily, at least 12 to 13 hours if you sit consistently without even taking a break. Break मतलब 1 घंटे का break, 2 घंटे का break नहीं लेना भाई. 5-10 मिनट का break काफी है. Every 1 hour take 5 minutes break. Okay, that is very very crucial because that increases your capacity of learning more and also you won't forget it. If you study, strange doctor, if you study daily from today onwards, after this session, daily 12 to 13 hours and be perfect with these subjects. Right now, I know you haven't studied surgery and all. Go to the YouTube, surgery rapid revision, जो video पहले आएगा वो देख लो. Okay? Medicine rapid revision, जो video पहले आएगा वो देख लो. Be perfect with those. Then I cannot tell you you will get 200 plus, but 150 plus तो पक्का आएगा. Okay? Bala, that is enough. That is enough, Bala. So remaining doctors who are here, 244, you don't have any doubts. Prip or Marrow GT, any better? Anything is better. Either Prip Ladder or see, I'm not here to promote any app. I'm just here to guide you. So if you have an app by name Prip Ladder, if you have an app by name Marrow, anything is better. Anything is better. If you want to do GTs, anything is better. Okay? But Marrow, the questions will be little bit more difficult. Okay? But if you are done Marrow questions, all of them, if you have gone through at least 60-70% of the questions, you will definitely get 200 plus. But I don't prefer you in these last 20 days because these difficult questions might make your confidence low. So इसलिए better go for Prep questions, or we even have in the Telegram group the Arise Medical Academy where you have the MCQs also. So you can join that and get the MCQs also. बायोकेमिस्ट्री का टॉपिक्स चाहिए, ये देखो ये है बायोकेमिस्ट्री का टॉपिक्स. So Singla is telling I have been doing previous year questions and doing grand tests. I score around 180 to 185. Very good score. Very good score. But when I attempt the exam, I'm not sure about how many questions. ये देखो यही problem है. She is getting a very good score in the grand test, but she is not sure in the exam she will be able to attempt the questions or not. Keep this thing in mind. If grand test questions are this level, grand test questions are this level, the exam asking questions will be at this level. Yaad rakho. Take a screenshot of this also. Grand test levels are at this level. The real exam questions will be asked here. Okay, the complexity will be less. It is because of your fear you take this hand here. This is the only mistake you do. Okay, ye mat karna. Grand test you are done, it means you are doing the real paper. Same paper you will get it in the exam with a less complexity. Trust me. Okay. Any more questions, guys? Any more questions you have to ask me? You have got any more questions over here? So, Ayushi Verma is telling that you have got 119 in GT, which is very good. 119 is GT in grand test. How to improve? How you have to improve in grand test is that basically whatever questions are going wrong, so write down those questions, not the questions, write down those topics. Okay, so write down those topics, and I'm telling you, along with image based questions which I told you to do every day night 1 hour, go through these questions which are getting wrong. Okay, so this will help you a lot. It will help you too much, I'm telling you. Okay, yes, Tyson, I am also going to do the one liner questions live session also. I will do. Chill life. I'm not Tamil. I'm not Tamil. I'm not Tamil. Let us put it this way. I'm an Indian who speaks Telugu. Biochemistry, rapid revision. Rapid revision biochemistry is more than enough. You need not to study complete detailed biochemistry. More than enough. Sir, I'm getting 170 to 175 marks in the GT again and again. What should I do? Is it enough score? It is enough score. I'm telling you, it is the enough score, right? You will pass the exam, but don't take it lightly. Till 20th. But see, these 20 days, try to maintain that score only. Okay? You keep in your mind, 170 is not enough. So I'll go little bit higher. How you go little bit higher? Whatever questions you get wrong, collect it, put it on the paper. रट लो, अगर one word answer है तो study with concepts, whatever it is, be perfect, give the next grand test, at least try touching 180, 190, 185 and all, that will be more than enough. Sir, when to study one Pawan is asking, sir, when to start studying one subject, then worried about others to complete the revision. Sir, please tell how to manage it. If you are the student who have studied all the subjects by now, and if you are left only with revision, what I prefer you is that morning one subject, afternoon one subject, evening one subject. So revise in this way. Whatever subjects you want to choose, it is your wish. But what I tell is that the memory power, what do you say, the grasping power will be more in the morning. So I prefer you to use major subject like surgery, medicine and all in the morning. Baki, afternoon and evening, it is your wish. Most of the students feel after studying 5-6 subjects perfectly, they enter into the 7th subject and they feel that, did I really study 5 subjects? Did I really remember these 7? Are these 7 subjects really in my mind right now? Okay, let me check. Now you recollect one random topic and that topic doesn't hit you. You might completely get low, but remember this thing. Whatever you have studied is already stored within your brain. You might not feel it, but it is already stored. When I give you a question of that particular topic, automatically you will answer that question. Okay, this happens with you, this happens with me also, with everyone it happens. So if you are feeling that you might not remember all this, forget it, that is a lie, you will remember it. Okay, sir, one liners are best. If you want to study one liners, you can study one liners. मुझे लगता है टाइम पास के लिए पढ़ लो वन लाइनर्स, ठीक है सर. PYQs ही करे and FMGE solution enough. FMGE solution book if you have, that is more than enough. But FMGE solution, each and every question with the concept, if you study, more than enough. If anyone of you is having FMGE solutions book with you, वहां पे ना लास्ट पेज में you will have a table of paraphilias. Okay, study that. Even schizophrenia, all these topics which I told you, all these topics are going to be there in that FMG solutions. Be perfect with that. That is enough. Sushil, Maulika, Maulika, look here. You have got 122 to 130. Okay, in the last two attempts are very less. You even have to give more attempts. Okay, try giving 3 more attempts at least. Okay, every 2 days once give the grand test. I'm telling you, if you are still maintaining 130, 140, chalega, you will pass the exam. I'm getting mock test 172, 210. I never failed in the mock test. Definitely, Sushil, you will pass the exam. Don't worry about that. Definitely, you are going to pass the exam. But don't take this as an overconfidence. Okay? But definitely, the honest thing is you will pass the exam. Pharma previous year questions works. I cannot tell you because most of the time in the pharma, direct questions will be asked. So, they can ask you question from any area in the pharma. Okay, so you cannot completely rely on the important topics, but still I will send you the important topics from pharma. Those important topics will be more than enough for you. Okay, Nani, it is more than enough. Trust me, it is more than enough. Shazal, hello sir, I've been given subject test and in this most of my latest net correct and FMG. I don't know where I'm going wrong. So all of you, what you do is Shazal, whichever questions, see guys, it is very simple. Most of your questions are, sir, I'm getting 140, 130 in the grand test. How should I improve my score? The only way you can improve your score, you know the answer. There is no magic, there is no mantra or tantra here. You know the answer. The only answer is, जो भी question गलत हो रहा है, whatever question is getting wrong, pick up that question, put it on the paper, revise that daily. Very simple. If you do this, trust me, that question will never get wrong. That question will never get wrong. The questions which you have put correct might get wrong, I don't know, but these questions which you have practiced after getting wrong, this will never get wrong again. Believe this thing, okay? Whatever questions are going wrong, pick it up, put it there, revise, repeat and all, okay? This is the only thing you need to do for all those who are not able to get a desired score in the grand test, okay? So Sushil, let us put it this way, Sushil. Trust these things here. Trust these questions here. Okay. So let us put it this way. So I can understand that this is the 5th attempt for you. Be perfect with these topics and these subjects which I have told you, Sushil. Okay. Be perfect with these topics and these subjects. And after the exam, when the results come, again let us meet. Okay. So you will even have my WhatsApp number, so you can message me and then let me know your result. Sultan is asking, what is the minimum satisfactory score one should get at least in grand test? The minimum score, it depends upon how difficult the grand test is. Usually the scores around 160 to 170. That is the minimum score which you need to get a very good mark. Very good mark, not the pass mark. Pass mark ke liye usse kam. Very good mark, 160, 170 is fine. Pharma, do RR, very good. You can do RR. Yes, Gokul, I will share this PDF along with an additional PDF. Dr. Krishna official, that is the official name of the Telegram channel. And anyways, I will also put the Telegram channel down here where I will be posting you the PDF also. So Dr.G Banu Prakash. So there you will have the complete notes and everything. Yeah, yes, Sushil, I can understand. That is what I told you. Trust me this time. Trust me this time. Be honest to yourself and study these topics. Okay, don't even miss a single topic. Be honest to yourself, study these topics. After the results come, let us meet again. Okay. No, 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 Apeksha, not in IPC, not in PSM. I'm talking about forensic medicine. Okay. Doctor aspiring, not needed. Why will you do NEET PG questions for FMGE? They are at little bit of higher end. You need not to do those questions. Okay. The anonymous, you have a dot question. What is this dot question? So guys, I think most of your questions I have answered here. Most of your questions I have answered over here. एक चीज याद रखो, overall I'm telling you one thing. 20 days also you can pass the exam. One example I will tell you. Once FMGE, once FMGE was conducted in August 2020. Okay? All most of them thought that this FMGE will be in the month of December. Okay, in the month of December. No, the June attempt. Sorry, the June attempt. 2020 year, the June attempt, they shifted it to August. Okay, they shifted it to August. Now most of the students, mainly from Ukraine, they got graduated on August 1st, or before August itself they got graduated. Just 1 month before August they got graduated. They hardly had 20-25 days for their exam. So there were around, let us say, personally whom I know, there were around 75 students who just thought to go give an attempt and come to just see how the exam looks. Okay, they still didn't even got their complete diploma and all. They just got their provisional certificate. With the help of that, they applied for an exam. They went. They have written the exam. That time they did not buy any app, nothing. Telegram में जो materials है, they downloaded that. Few important subjects they have studied. Grant test, they don't even know. They don't even. They didn't even look at the grant test. They didn't even do any grant test. Nothing of that sort. And I'm telling you, out of 75 students, 28 students passed the exam just by studying 20 days. So you guys, in comparison with them, you see how lucky you are that you have got a very good time to study for the exam. Now this is the time for you to revise the exam. Okay, revise all the subjects, revise for the exam. So what I'm telling you is, if you are perfect with these subjects based upon the priority order, I'm telling you, definitely you will pass the exam. And the topics which I have shown you here, and the topics which I'll be giving you after few minutes after the session in the Telegram, if you are perfect with these topics, just have a checklist. If you are perfect with this, definitely you are going to ace the exam. Daily in the night, 1 hour image based questions, don't forget it. Don't forget it at all. Daily IPC sections, paraphilias and all, don't forget it. Milestones, I am telling you, one question definitely will come from milestones. I told you, milestones, don't forget it. Okay. So these are some of the parts which you need to be confident. So if you are a guy who has already done grant tests, I'm telling you, you are at this level and the paper which you are going to write is at this level. ये तो पक्का है 100%. Okay, if you feel paper is getting difficult, paper is very difficult, इसका मतलब ये है कि your thinking process, the expectations which you kept on the paper, the fear which you kept on the paper is too high. That is the only thing. बाकी paper तो easy होगा. Whatever you have studied, the same things will be asked in the exam. Aliens won't come and set the paper. It is the humans, the doctors, the faculties only who set the paper. Keep this thing in mind. They are not going to ask you 8-9 paragraphs or 8-9 sentence length questions. Okay, hardly they will ask you 3 sentence lengthy questions or direct questions. Keep this thing in mind. Okay, now after this, I think this is mostly enough, guys. So this is what I know. Whatever I know, I have told you. There might be some tricks and tips which I don't know, right? So you can get it from another, let us say, mentor, serial, YouTube पे video देख लो, कुछ भी कर लो. But whatever it is, I want all of you to pass the exam, guys. So this is what I'm telling you. So this is what, according to my knowledge, according to the research which I have done from 2 weeks, I have called each and every faculty which I know personally, and I have requested them. Most of them didn't even have. Most of them didn't even have time to talk also. So I personally visited them. I talked to them, right? And then I got the topics and all. Whatever it is, I wanted to honestly give everything from my side. I have given. If I missed anything, if I missed any topic here and all, if I missed any point that I have to tell you, right? If there is anything wrong, then please correct me. Just in the comment box, just write it down. Okay? So that for your next batch, it would be as a useful thing. So this is what I want to tell you. This is what I feel. Okay? So honestly, I will also pray for all of you guys that you have to pass the exam. ठीक है? ये pray करूँगा कि 150 तो आना चाहिए, 200 तो it depends upon you, है ना? So this is all I can do. I think you love this session. You love this session, guys. So don't worry. Thank you so much, Yashpal. Don't worry. Definitely you will pass, because there are people who already passed in last 20 days. You will also pass. Okay? There is no change in the exam. Everything is same. Pattern is same. Blueprint is same. Sab kuch same hai. Okay? So all of you, and don't forget, my prayers will always be with you. Keep that thing in mind. So अभी pledge लेने की जरूरत नहीं है. But after the exam, I want all of you to come back to this video and comment down, right, about this session, that this session is useful for you or not. Just give me a second, guys. Right? And next important thing is that in this channel, we are planning to do the rapid revision of all the subjects. Okay, all the subjects rapid revisions will be done. The image based questions, the previous year questions, everything will be done. So what I'm telling you is, you just stick to one faculty, or let us say stick to one channel, and be perfect with all of this. So this is what I can tell you. And second important thing is that in these 20 days, daily one subject we are planning to put a quiz. Okay, so we are planning to put a quiz. I mean, not the topics. We are planning to put mainly the quiz of each and every subject in these 20 days, right? So it would be beneficial for you. If you have time, you can join there. The things which I spoke, the topics which I have given, from those topics only the questions will be there, right? Or little bit more, when few topics might be added, might be deleted, ज़्यादा फर्क नहीं पड़ेगा. So these are all the important things. So most of you students, you are thinking that, sir, I don't have app, मैंने grand test किया नहीं, questions कहाँ से करूँ? Most of you are telling from where we have to do the questions. So for those students only, we are putting a quiz every day till 20 days, every day each subject. Okay, so you can do these questions, and in the Telegram group also, every day the questions will be posted there, the notes will be posted there. So below the YouTube video, you will have the link for the Telegram, so there you can find each and everything. So I hope all of you are good with this session, guys. So thank you so much. Thank you so much for joining. Thank you so much for listening to me. Thank you so much for trusting in me. Thank you so much, and love you all.